since it's an isolation room, I want to take my supplies with me because I'm not allowed to, once I got dressed up, I'm not allowed to come back, right? So this area consider is isolation room, right? Because sink, every room has a bathroom, so sink and this area is isolation room. So my skill is to have the PPE on and then empty the urinary catheter bag, after that hand washing and record the urine output. So I'm putting my PPE on first, okay? So look the gown, if it's in good shape. So it looks good, okay? So first thing, what you're gonna put it on? The gown, okay? And then make sure you tie it good. And you always dress up outside the room, right? When you're going in isolation room, you always wanna get your PPE on before you enter. So it's always at the door. Try to cover your back as much as possible. And you can even tie on the side too. Now I need my gloves on. So make sure you cover the cuff of the gloves, cover the cuff of your gown with the gloves. Okay, now I'm taking this with me. So I'm going to say knock knock, may I come in? So wait for a second and then go over there. Okay. Good evening, Mrs. Smith. How are you doing today? I'm your CNA today. My name is Gurmeet. I'm going to empty your catheter. Is that okay with you? Okay. Can I check your ID bracelet? So check the ID bracelet. Okay, Mrs. Smith, just confirm. Okay, so I'm going to provide the privacy. Now I need to adjust the bed for working height. For this skill, you don't want to too much after you're done with your skill, because you're not going to be coming back over here because you take off your once you take off your PPE. So I want to make sure she has a call light. I want to make sure her tubing is fine. So just check her tubing if it's good. Okay, yeah, it's good. And then cover her back up so I don't have to touch anything after I'm done. Since I have my alcohol wipes and the barrier, so I'm going to put it over here and then get my alcohol wipes, 2 of them, and I'm going to open both of them because I've been eating both. So I'm open this up, set it here. I open the second one, and this is one I'm going to use first. So you wanted to get this out. It is locked right now, it's locked, so I'm not going to be spilling any, right? So once you open, the urine is going to start coming out. Before that, you want to clean the tip. Okay, now since the tip is clean, now you get the bag in the container, not to touch the sides of the container, in the middle. Now you open it. So it's open now. So the urine is coming out of this bag, so it's going in the container. Once you're done, you're gonna lock it, because if you don't lock it and you get it out, you're gonna be spilling outside. So you get it out, get another alcohol wipe, and now you clean again. Clean the tip. It's locked already. Now I have to put it back. Okay, so because this hand I was cleaning, so with this hand I can adjust if I need to adjust the sheets or anything I need to do it. Now I'm gonna get my things. So I have urine in here. I'm gonna go to the sink. Where's your examiner? I already have the water in the container, so we can set that over here. And now you're gonna read it. You bend on your knee and read it. So mine is like 475 ml. So now, pretending like I'm going to empty the content in the commode. Rinsing water in the commode, and that container gadget goes back to designated area. Now I'm going to remove the PPE. So first thing, what is dirty? The gloves. Go underneath and directly in trash. Now I need to open it up. Pinch the cuff, get my hand in, away from your body, roll it, and it goes to the trash again. Now with that is hand washing. So now I have to actually wash my hand. For a little bit. You can use more. Again, if you have to turn the water off, then you have to get another piece of paper. Since this is with the fit, so I don't have to do that. That goes in trash. Now I need my pen, and your examiner will be giving you a little slip where you put your name on and ml. So mine was 475. I'll be writing 475 ml on as the output, your patient output 475. Now, since my skill is complete, I can do hand hygiene again, and my skill is complete. Okay, good.